Okay, hello everyone. Welcome to this series of interviews that I am presenting with other weight loss experts. My name is Jean Nitre. I'm a weight loss expert, and this happens to be the last in a series of interviews with other experts. And I'll be picking up that, well, again in January, I'll be doing another series. But today, I'm here with McCall McPherson. She's a thyroid expert, and she knows a whole lot, a lot more than a lot of medical doctors know. And we're going to have a bunch of questions for her. And of course, I have the chat open on the right there. If you want to post any questions, we'll answer them for you, hopefully, unless there's too many questions. So what we're really up to is empowering you in your quest for weight loss. And expanded awareness has a lot to do with that, so that you know that you have choices that you might not have been aware of that can really make a difference for you in your weight loss and today regarding balancing your thyroid. So welcome, McCall. Thank you for being here with us today. That's great. That's great. And by the way, anyone who's attending and viewing, if you want to put in the chat where you're from, and if you have trouble hearing us at all, please let us know. We don't want to go unheard. So there's that factor too, just keeping things kind of clean and tight and workable here. All right, so why don't you tell us a little bit about yourself, McCall, and then we'll get into some questions and answers.
Yes, so I am the founder and co-owner of a functional medicine practice in Austin, Texas, that specializes in really complex thyroid disorders. I'm a PA, and I'm also a thyroid sufferer. So I initially started my journey and my quest as a person who could not get help in the regular medical community as a practicing clinician, and was 27 and going to bed at 3:30 in the afternoon every day, and could not really recruit anyone to help me. So after about a 6-month journey, I found my way to Answers, and now it's my passion to help other people in the same manner.
Excellent. So as a PA, that means physician's assistant?
Physician assistant, yes.
Okay, so you were working closely with mostly medical doctors, I assume?
Right.
Okay.
Yes.
Great. So you want to tell us a little bit about your journey? What were your symptoms, and what were your challenges, and what you found that worked?
Yes, so I had been a long time diagnosed with a thyroid disorder, and after I finished graduate school, I was already practicing medicine, newly married, 27, and every day after work, I would come home and literally lay flat on my back. Weekends were spent the same way, not leaving the house, almost not leaving bed. Repeatedly, I would go to my physician, who was my family practice doctor, who managed my levothyroxine or Synthroid at the time, and kept saying, hey, like something is really wrong. I'm not functioning. I cannot do anything but prepare and recover for my job outside of it. I was repeatedly dismissed and offered no solution. So after about 6 months, I got on the wait list for the only integrative medicine doctor in Austin back then. I waited 3 months to see him. And when I saw him, he had a really deep and innate understanding for how the thyroid works and how thyroid medications work. He tweaked a couple things in my lifestyle, changed my medication, and within 6 weeks, I completely got my life back. So obviously that changed the way I view medicine, and I started on my journey towards initial just curiosity about integrative and functional medicine, and eventually working my way completely into it. And now, many years later, I am the co-owner of Modern Thyroid Clinic, and my partner is actually the physician who gave me.
Great. Oh, that worked out pretty well.
I mean, he immediately became my mentor, and it's just a beautiful thing that we've built here. We get to help a lot of people. It's fantastic.
Well, that's so great you're doing that. So I do have a question about, you said it took you about 6 weeks to recover. And I have talked to so many people who have been on thyroid medication for years.
Right.
What would you say to that?
So, it's a complex issue, and I want to take you through just the basics of it. But the reality is that it takes almost a decade to get diagnosed in regular medicine. It's a decade of having hypothyroidism before the lab value that they check, TSH, drifts far enough outside the range of normal to classify. And then after that, people generally get put on a medication called levothyroxine or Synthroid. Same medication, generic brand name, but that is essentially inactive thyroid hormone, precursor thyroid hormone, kind of like crude oil is to gasoline. We have to be able to convert that hormone and activate it for it to help us. And I'll tell you, at least 80% of the people that make it to my office and my clinic do not convert that hormone, and they're not able to activate it well. So they end up for decades being symptomatic, and they keep going back to their doctor and they keep increasing their medication. But the reality is if we're looking at that hormone as crude oil, right, and we need to convert it to gasoline, we can have all the crude oil hormones in the world, but if we're not able to convert them to gasoline, we're not going to get better. We're not going to get symptomatic improvement. So the reality is people get stuck in that wheelhouse of really only one option. And there are so many other options that have either all active hormone or components of both, inactive precursor hormone and active hormone. Really, by and large, I can't speak for the general thyroid population, but for anyone that comes to my office, no one converts well enough to handle Synthroid or levothyroxine.
You said no one what?
Converts well enough to handle Synthroid or levothyroxine. So they just end up perpetually symptomatic, and no one's presenting them with alternatives in the same way that no one presented me with another option.
Right. Wow. So what's one of the main concerns that people have that come to you?
Fatigue, weight gain, brain fog. Those are the three things that usually have gone on for so long. They're just really debilitated. I just spoke with a woman today who's gained 40 pounds in the last year and a half, and she's a marathon runner. Like, she hasn't changed her diet, hasn't changed anything. Her doctor tells her, oh no, your thyroid labs look great. But right, when a marathon runner is gaining 40 pounds in 18 months, something is not right. And in fact, she does have hypothyroidism, but has been repeatedly told she doesn't.
She has what? She has
hypothyroidism, but has been repeatedly told that her thyroid function is fine.
Right. Wow. So what are, so if someone had, okay, I'm thinking of the symptoms. Are there a number of symptoms that if someone has all of those, for sure they have thyroid imbalance?
Yeah, I'll name off a list, and if you have at least 7, it's a very good idea to get a lab workup, and I'll tell you exactly how to do that because it's more thorough than physicians often order. But fatigue, brain fog, depression, weight gain, low sex drive, dry skin, brittle nails, brittle hair, kind of loss of the outer portions of your eyebrows, elevated blood sugar and cholesterol, right, going right with the weight gain, constipation, cracking on the bottom of your feet, all of those things.
Wow.
So 7, it's a pretty darn good indication that you should probably get some good lab work.
Right, exactly. So if someone thinks they're, if they have a few of those symptoms, and probably most of us do because we're living in a relatively unhealthy society here, but if they just think they have a few symptoms and they want to kind of take care that they don't exacerbate a thyroid condition that might be coming on, is there anything you can suggest that they do or don't do?
Absolutely. So our lifestyle impacts our thyroid in 2 specific ways. So one is the actual conversion of our crude oil to gasoline hormones, right? Our precursor hormone to our active thyroid hormone, what's called free T3. In that conversion process, there are several things that are required or that can help facilitate it. So exercise helps facilitate it. Basic micronutrients and minerals that supplement companies have very nicely packaged in like one little pill, right? Stress management, meditation's a great thing. Eating really good foods that are low inflammatory help facilitate conversion. as opposed to eating poorly nutrient dense foods that are inflammatory, that do not help conversion, actually inhibit that process and exacerbate your thyroid function and biochemistry even more. The other way that lifestyle really influences our thyroid function and protects it from progressing is by either preventing or stopping the reaction of Hashimoto's, which is the autoimmune disease associated with hypothyroidism.
Right.
So functional medicine, really where we thrive is in autoimmune disease, because we consider it a lifestyle mediated condition and thereby modifiable. And so the biggest way that I immediately mediate or impact my patient's Hashimoto's status is by really running an IgG food allergy test or putting them on a pretty low inflammatory diet. The most common foods that I see objectively in black and white with lab analysis with my patients, with my Hashimoto's patients, that is driving inflammation is dairy, gluten, and beans, legumes. So moving away from those foods really in and of itself markedly reduces your risk for Hashimoto's and can even put you into remission if you already have it.
Interesting.
So big impacts with thyroid dysfunction and lifestyle.
Right. Are there any distinct symptoms that are are there some symptoms that are for hypothyroidism and some that are for hyperthyroidism?
Yeah, so there's different ones for hyperthyroidism and even Hashimoto's. So hyperthyroidism is called Graves' disease. It's actually the complete flip side of hypo. Commonly there you get like heart palpitations, weight loss, really shaky, anxious, sweating, heat intolerance, kind of the complete opposite picture of hypothyroidism. Sometimes people will get bulging of their eyes, which is called exophthalmos. And then again, in the separate category of Hashimoto's, commonly people have symptoms of hypothyroidism, but in addition to those, they'll have often a goiter where their thyroid's a little swollen. You've probably seen people with a little bulge right here. Yep. That's a goiter, that's active autoimmune kind of activity that's creating an inflammatory response. Commonly, my people with Hashimoto's too have anxiety. They have an anxiety component, and then often they have another autoimmune disease.
Okay, why don't you tell us about what the thyroid does? What is its function? It's a major function, and I want to hear that, or functions plural, and I want to hear that from you.
So it's kind of like a master gland. It impacts our entire hormone cascade from pretty much at the top upstream. So when we get low thyroid function, commonly our sex hormones, our reproductive hormones drop. It disrupts our periods. It really decreases chance of pregnancy, increases chance of miscarriage. It also is very closely related to our adrenal function. So the two kind of communicate and they go hand in hand. So when your thyroid goes out, you tend to get adrenal stress, just compounding the issue. What else? It regulates our metabolism, our blood sugar, our energy production. To think about it simply, you can really just think when your thyroid starts to decrease in function, everything slows down and dries up.
Slows down and dries up. That sounds like aging to me.
Well, thyroid problems for women very much come with aging and children.
Yeah.
Which both go hand in hand.
Yeah, compounds the whole problem, right? Exactly. So is there anything in particular you recommend in terms of exercise to keep the thyroid healthy? Or, I don't know, maybe just tapping it. Does it like to be tapped? Does it like to be stroked?
No, I don't know. I need to find that out. I haven't done any research on that. I will look that one up. I like that suggestion.
Well, because we have this electrical component coming from our fingertips, so I think tapping is really generally a good thing, right?
Right. I know about tapping, but I'd never thought about it in relative to the thyroid. So I'm really going to dig up some PubMed articles on that. Thanks. As far as exercise goes, the one big thing that I emphasize to my patients is by the time you've had pretty prolonged thyroid dysfunction, our adrenals have certainly taken a toll, and they're usually somewhat fatigued. And so you have to approach exercise with a little bit of caution, especially in the realm of like high intensity interval training or, really, really intense things like CrossFit. Your body has to be really in tip-top shape in terms of your adrenals to handle it well. So I really emphasize restorative exercise. Weights is great. Even light jogging is great, but no, really, really intense interval training. I try and emphasize people staying away from. In fact, that can flip your conversion and actually make it even worse.
Wow. Wow. So when people typically recover and get a healthy thyroid, do you recommend exercise at that point? A little more intense exercise?
Yes. So after adrenals and thyroid have been appropriately addressed, you're kind of set free. Really, I tell people never exercise more than your body leaves you energized a few hours after. So if you exercise and you're really tired, but 3 or 4 hours later, you're just kind of trekking right along, that's completely fine. But I have patients who come to me so far at the end of the disease pattern that they'll exercise and they'll literally be in bed all day, 3 hours later, and at that point, you're doing so much more damage than good.
Right, exactly. Wow. Wow, this is really interesting. And I know you have a really interesting gift for us too. Why don't you tell us about that, Michal?
Yes. So, really part of my goal as a thyroid advocate is to pull back the curtain in essence so that people have as much access to information as they can, because the reality is medicine is falling a bit behind in our specialty of diagnosis of thyroid disorders and management as well. So, what I am giving you today is a free lab guide where you can see exactly what labs you need, and then I break those labs down for you and give you my ranges, which are very, very different than the ranges that conventional medicine goes by. Conventional medicine, honestly, they look at your labs and they see if anything's in bold or off to the side, and that's what's marked abnormal. But every lab range is different, and none of them have excluded people with hypothyroidism when they formulated the normal ranges. So they're just complete. People can be very, very sick and be in the normal range. I'm a perfect example of that. So that's what I'm giving you. If you don't have access to get the actual labs drawn, if your doctor says, no, I'm not going to order these extra thyroid lab tests you're requesting, you can go to yourlabwork.com/Michal and get like a full thyroid panel. I think it's $127. So very, very cheap, very reasonable. If you can't get them covered on your insurance, I encourage you to do that. You can download my thyroid lab guide and I'll enter it into the chat menu, but at modernthyroidclinic.com/gift. So
what was that / what?
Gift.
Gift. Okay.
Mm-hmm.
Okay. Well, why don't you put that in the chat?
Yeah.
Whatever it is that you can, that will.
I will.
Get us to your gift, because again, that's empowerment for people. And great, thank you for that. Now, here's another question. So what would people look for if they're looking for a thyroid expert? Yeah, you can Google that. You can Google everything, but
that's hard.
Yeah. Are there certain questions you would ask that person, like an interview, or what do you suggest to?
That is a fantastic question. So one, what labs do you run? And you want to be sure they correlate with the labs in my lab guide, which is not only TSH, very much it has to include T3. You want to ask what kinds of medications they prescribe. I would in particular ask if they prescribe natural desiccated thyroid, like Armour, Nature Thyroid, WP Thyroid, those types of things. And what would the third one be? If they address the root cause of Hashimoto's, right? if they can help people treat that as well, because that's a huge implicating factor in recovery. There are some basic resources to help guide people on good doctors. So Hypothyroid Mom has a list of resources for people. Dr. Isabella Wentz has a list of recommended clinicians. And Mary Showman also has a kind of an old, outdated list, but it could still be.
Yeah, I know Isabella. She's really good.
She's fantastic.
I'm getting an echo here.
But
I don't know. So, also, why don't you put into the chat your calendar or your or how to someone might reach your administrator, because
Sure.
If they wanted to make an appointment for a free consultation with you. And then, do you do business with people a long distance, which is so possible to do these days for the most part?
Right. So I do see patients out of state, and even I had one yesterday from out of the country, but I have to see them in person for the first visit if they're out of the state of Texas, and then we can follow up by phone or video chat. Or if you're in the state of Texas, I can see you virtually. I can consult with anyone. Commonly, people will ask me to give them advice on their labs, give them advice or what I would do for my patients with medication, but without ever prescribing medication, and then they can take that information back to their local doctor.
Great. Excellent. All right. So you're going to put your admin person's contact information in there?
Yes.
Awesome.
And then my websites.
Okay.
www. You got that.
Yeah. All right. Well, excellent. Thank you so much for talking with us, McCall. And I hope that this is helpful for a lot of people who are looking, or anyone who has a thyroid problem. Be sure and refer them to McCall McPherson is her last name. And because there is help out there. You don't have
there's help and hope.
There's help and hope, exactly. And there's empowerment. So you just need to start making the right choices in terms of practitioner and food and lifestyle. Is there any lifestyle shift that you might recommend? Maybe better sleep, more sleep, that kind of thing?
Better sleep, more sleep is huge for conversion, as is exercise. I would absolutely recommend people take a basic thyroid supplement. I really love Zymogens as well as Designs for Health. Those are the two that I use with my patients most frequently. That gives them everything they need to facilitate conversion, and just give the basic things to help your thyroid function. Like I said, exercise, and the biggest piece of advice I would give is a low inflammatory diet.
A low what?
Inflammatory diet.
Right. Yeah. Low inflammatory diet. Yeah. Your whole body will be happier from that. Yeah.
Right. It's huge.
All right. Well, I don't see any questions in the chat. Maybe people are going to be viewing this later. So we're going to sign off for now. And thank you so much once again, McCall McPherson. And we'll be seeing you around the internet.
Thank you so much for having me. Have a great day.
My pleasure. You too. Bye-bye.
Bye.